What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, July 25th, 2024. If you're new to my channel, this is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there, and you need to know what's going on with each of these viruses. I provide you an update on that each and every day, and I tell you what the COVID levels are across the U.S. and sometimes around the world as well. Today we're going to see new data just in from the United Kingdom, which this week does feature a continuing trend that's not so nice. So, if you're new here, subscribe to my channel down below, give this video a thumbs up, hit that notification bell, share these videos with anyone you know, and of course, remember to leave your comments down below. Alright, we do have several news stories to talk about today, and we do have several states that have updated. One state that we have not looked at in a very long time, and I don't think we have ever pulled up their dashboard here on the pandemic update. If we have, I'm forgetting about it. Yeah, so stay tuned for that. We'll have that after the New York portion of today's update. All right, starting off in Chicago today. COVID-19 rising again in Chicago, but experts urge precaution, not panic. The COVID-19 test positivity rate in Chicago for the week ending July 19th was 9.8%, up from 7.6% the previous week. Hospitalizations also have increased, but not quite at the same rate, officials say, and it's pretty much a trend that is ongoing all across the United States. COVID hospitalizations are rising. COVID positivity rates are rising across the majority of the United States. There are a couple states that have peaked and are starting to drop, which is a good thing, but the vast majority of states and cities are still rising at this point. Hong Kong. Yes, this is relatively interesting. Hong Kong's longest flu season comes to an end after more than 6 months. That's right. Their flu cases were rising and were elevated for 6 months. The current influenza season had lasted for 28 weeks, which is not common in Hong Kong, a department spokesperson said. So they had a really prolonged period of flu cases in Hong Kong. Yeah, not a good thing at all. Alright, wanted to share this with you from Eric Topol, and this has to do with air quality. Bad air quality and poor ventilation substantially contributed to spreading COVID. We know darn well that when we are in crowded places and, it's really compacted together, there's poor ventilation. When your air nets, if you have one, comes up with a high reading, right now it's 653 in here. That's not bad. But when it hits 1,000, it goes up to yellow. When it hits 1,500, it goes up to red. When those O2 levels get really bad, where you have really bad air quality in a room and you're crowded with people, there's a higher chance you could get infected, especially now with there being such a high level of COVID around the country. Clean air. I have an air purifier behind me. We have another one downstairs. Air purifiers are very important, not only to prevent COVID, but to prevent all these other things that you may be breathing in. If you're breathing in bad air quality, it's not good for your lungs whatsoever. And I posted a picture on X today. I'm not going to show it here, but if you want to see it, it's over on X. I changed out my cabin air filter of my car, and you should take a look at that. It's, that's just 1 year's worth of bad air quality and anything else that falls in there, leaves and stuff. Yeah, we have to breathe in that stuff. And that's the air that we breathe in. When you filter it, it catches some of the stuff, and then we don't have to breathe it in. But when you're in an unfiltered environment, even just going outside, I hear some people say, oh, when you have a mask on, oh, that fresh air is really going to get you. You know what? That air is not as fresh as you think it is. And Then when you come into the indoor settings, when you're breathing in bad air, well, some of that bad air could be COVID as well. And outdoors, there's all kinds of endless number of things that we have to breathe in. More on air quality in just a little bit. All right, Ohio this week. COVID cases up for the 8th week. Yeah, this is not good. This is their coronavirus update for Thursday today, July 25th, 2024. And yes, this is not good. Cleveland, Ohio, for the 8th consecutive week, the number of new COVID-19 cases in Ohio worsened, rising from 3,896 last week to 4,575. Now, I get it. That is the number of cases spread out throughout an entire week, but they're continuing to see some significant increases. Should this keep going? Well, heck, next week could go over 5,000. It's a possibility. This is not good. This started back at the end of spring, early summer. They did have a little lull, and then they started rising once again. Yes, this is not good, especially in a time where so many people use these right here, the at-home test, and don't even bother to report it. So it makes you think the real number is much higher. Total cases from the start of the pandemic in Ohio, 3,768,753. That's up by 4,575. Individuals with the vaccine, this is actually an interesting number, 1,380,406. Yeah, it shows you how many are unvaccinated in Ohio. Reported deaths from the start of the pandemic, 44,022. That's up by 14. Total hospitalizations, again, they do it from the start of the pandemic, 152,243, but that went up by 115, excuse me. Total reported ICU admissions, 15,832. That is up by 1. So, yeah, things are rising in Ohio at this time. And back on July 18th, if you put this into perspective, the hospitalizations actually did rise more back at that time. So the rise in hospitalizations is not as big this week, but again, it's another 115 people that had to be hospitalized at some point for COVID in Ohio. All right, now for the weekly update from Mike Horger, and some bad news here. This is the PMC COVID-19 forecast, July 25th, 2024, and he says the U.S. is hovering around 900,000 daily infections. Nearly 2% of the U.S. population is actively infectious with COVID. Ultimately, such infections are expected to result in 40,000 new daily long COVID cases by his estimate. Then he puts, the popular hashtag, y'all masking. That is a popular hashtag. I've used it a couple times. Show myself in a mask over on X. Then we come down to this. In the rising ninth U.S. COVID wave, we have higher transmission than 69% of the pandemic, lower than during 31% of the pandemic. In a deck of cards, imagine the Jack, Queen, King, and Ace as days with higher transmission. All other cards are days with lower transmission. And you can see here on his forecast graph, it's looking like he is expecting cases may get close to 1 million per day. Let's zoom in on this. Yeah, take a look at this. It's looking like as we head into August, at some point in August, we may get close to 1 million cases a day. All right, coming down here and reading on, and he does talk about it now. How many people will you interact with this week? Here are the chances at least one of those people is infectious with COVID. 20 people, 1 in 3 chance. Take a look at this. And we were just talking about that piece from Eric Topol on X, how poor ventilation, bad air quality can lead to higher cases. Well, guess what? In a lot of cases, when you're dealing with these higher number of people that are on this scale here, let's just say it's 100 people and you're in a crowded room, it's for a party, poor ventilation. Well, right now, 85.74% chance that someone's infectious, and we know poor ventilated places like that, you have a higher chance of being infected. So it's really a double whammy when you think of it that way. And continuing on here, it says we are still very much during COVID at this time, and he says you can take a look at the full dashboard on his webpage for the pmc19.com/data. So yes, things are not going well here in the United States, and he did put just 15 hours ago. Today, viral wastewater modeling suggests a U.S. summer COVID wave may soon surpass 1 million daily infections. Wow, that is a big number for the summertime. If it's that high now, just think what it could be in the wintertime. But the key note is hospitalizations are not as high as last summer, and deaths are not yet as high as last summer. But remember, this wave is a month early, and all these factors do lag, so we'll have to see what happens. Right now, I'm not expecting deaths to get as high as last summer, but only time will tell. Deaths are going to continue to rise. Alrighty, taking a look at the weekly update for the UK, where this week it looks like we can talk about cases and maybe deaths as well. This week, the numbers continue to go up. Cases, 3,557 in the last 7 days, our average, and they're going up. 152 is the increase. That's a 4.5% increase. Deaths, weekly deaths, 197 up to July 12th. They added another 197 deaths, and it says here 34, and that accounts for a 20.9% increase. So yes, deaths are going up, and there is no update this week on healthcare. Does not look like that has increased, or excuse me, does not look like that has updated since June 28th. I think they do that monthly. And taking a look here, yeah, you can see here the chart does show deaths are continuing to rise at this time. All right, drum roll please. Pollen levels. Pollen levels are highest in the plains today, where we can see there is some orange in some states such as Colorado, Wyoming, Montana, Minnesota, North Dakota, South Dakota, and in portions of Nebraska where there is orange. Also some yellow surrounding that. Some of that does make its way over into the northeast. A little bit of yellow in Texas. The extreme southeast, though, is in the green for today, so that is a good thing. Air quality levels. Air quality levels continue to be bad in a lot of areas at this time. Take a look here. We can see here that there are reds up in portions of the Rockies, portions of California, a lot of orange in the plains, and some of that, as expected, I showed you that model yesterday, some of that smoke has made its way down into portions of Washington, D.C., Pennsylvania, New Jersey, Ohio, Indianapolis, Illinois. You can see here, we do have smoke. There's a cold front that's coming through this area. It hasn't completely gone through yet, but look at this. I mean, it's really hazy. The air quality is not great right now across portions of Baltimore, Washington, Philadelphia, New York City, Pittsburgh. It's not good. Limit your time outdoors today. That is one thing I think I am going to try to do this evening, now seeing that things have gotten a little worse here. And again, the planes are not doing well either. All right, moving on. There are still some problems ongoing with heat-related illnesses. This is going to continue for several more weeks. We're still in the middle of summer. We have all of August to go through, and sometimes heat now goes straight through September and even into early October these days. Heat-related illnesses, they're high in the Northeast. They're high in pretty much every region. The lowest region would probably be the Northern Plains. You still have some, but it's just not as bad there. All right, want to learn more about climate and weather? You can do so over on my other X account, Climate Data Report. Hey, look at that. We're growing. 522 followers now. Let's keep that happening. And today I talked about the wildfires. I tweeted some stories about a typhoon that's ongoing over in China. There's a lot of stuff going on around the world. I'll be tweeting some more stuff again this evening. Philadelphia yesterday had 852 EMS incidents reported. A live look in right now at what's going on in Montgomery County does show we do have stroke going on in Lower Salford, and just a few calls. Not terribly busy. And elsewhere in southeast Pennsylvania, over in Chester County, Pennsylvania, oh, there's something I'm not liking. Not one, not two, but 3 respiratory difficulty calls. Heart problems and some other stuff mixed in. Again, let's go back to air qualities for a second. Southeast Pennsylvania, bad air qualities do include you. So, yeah, we're not breathing too well here, and it is starting to cause some problems over here on the EMS calls. And as we know, Pennsylvania on Thursdays does do a second wastewater update, and Chester County has been continuously rising, and it's showing a large increase right now. Montgomery County, Pennsylvania, Lower Montgomery County, over in Abingdon Township, is reporting an increase, but when you go up to Pottstown, which is like the northwestern portion of the county, it's showing a decrease at this time. Harrisburg area is the capital, Dauphin County, showing an increase at this time. The increase has slowed down to no change in Center County, Pennsylvania, for this week at State College, Penn State University. There are some summer classes there, but nothing major. Scranton is showing an increase this time. Up in McKean County, large increase. Erie is showing an increase at this time, and Mercer County is showing an increase as well. In Walgreens this week, 39.6% positivity rate. That's up 0.4% from 39.2% last week. Total tests, 7,637. That's up from 6,767. Canada, let's refresh this in case there was an update. COVID activity level is high, flu A and flu B both moderate, and RSV is low at this time. Now let's move over to some CDC data real quickly, and let's take a look at the latest variant from the CDC, and that is KP.3 variant, which is currently at 32.9%. KP3.1.1 is at 17.7%. KP2.3 is at 12.8%, and LB.1 is at 10.5%. No variant update tomorrow. That comes next week. We will get some of the other CDC data to update tomorrow. Moving on to New Jersey now, which New Jersey is reporting 470 hospitalizations, 13 people on a ventilator. In the ICU today, if it will come up, in the ICU today, 59 people. That number has been continuously going up. And discharges, 67 discharges reported at this time. New York State today, a big 2,785 new cases. You can see here, this level, it's continuing to going up. There's no sign of a peak at this time. I thought we may see a sign, but it's continuing to go upward. And we'll just have to see how much longer that continues. Remember, Thursdays, there's a lot of factors as to why the number's higher. Big one being New York City gets added in on Thursdays. Hospitalizations in New York State, 1,150, with 110 people in the ICU. Already, we have completed New York State. Time now for a state we have not looked at in a very long time. Remember when we used to go to that old B&O page or whatever it was? We could see some Louisiana data there. Well, let's take a look at what's going on here in Louisiana. First off, the positivity rate. Yeah, look at that. It has skyrocketed all the way up to 17.3% in Louisiana. That is not a good thing. Can we take a look at emergency department visits? Let's see what that is doing at this time. And it does show here, COVID-19 emergency department visits. They do continue to rise at this time. And it is 2.8% of all visits right now are for COVID-19. I don't think we can click on hospitalizations. Let's click on death data and see if anything comes up for that. And it says here, COVID-19 deaths. I'm assuming this is just for this year. Yep, 2023, 2024. So I'm assuming this is for this year. And it last updated on July 19th, 487 deaths have been reported in Louisiana so far this year. Not going to click on hospitalizations because I'm pretty sure I checked it earlier and that does not work. All right, moving on now to Colorado this week. And I do need to refresh this just to make sure that it's working. And Colorado did report an increase in hospitalizations. Once again, it's now up to 135. That is up by 12. The positivity rate in Colorado up another 3% to 18.9%. Cases reported this week. Wow. 2,043. That's up by 267. Again, that does not include these at-home tests and all the people that decide not to test. So that is up by 267. Emergency department visits diagnosed with COVID, 1.6%. That's up by 0.2%. And taking a look at Washington, number of people in the ICU for COVID, 17. That's down by 4. 10% decrease for COVID hospital admissions, and a 5% decrease for the emergency department visits, which are COVID, and that makes up 2% of the visits. Alrighty, a final reminder that you can go over to my website, datareport.info. New things are constantly being added. You can see my moderator Steve added a whole bunch of things today. I think I'll be adding some things this evening. You may see in the COVID positives archives, you may see a few names from people who have tested positive in the past. Going to be adding a couple of them down the line. Alrighty, folks, that does it for the Thursday edition of the Pandemic Update. If you like this update, give it a thumbs up, subscribe down below, hit that notification bell, share this with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.